Every patient who has got a knee arthritis has this question: do I need a total knee replacement? So in this video, I'll try and educate you as to when to consider a total knee replacement. This is our knee joint. It has a femur bone at the top and the tibia bone at the bottom. The space in between is the knee joint. The inside of the knee joint is lined by a smooth, shiny surface like this, called the cartilage. Both the femur and the tibia are lined by the cartilage. Arthritis is nothing but the wear and tear of this surface. When this surface wears away, we start seeing the bone from here, and that's arthritis. Patients with arthritis usually present with pain, stiffness, and swelling of their knee joints. So if you have got any of these symptoms, you might have got arthritis, and so it's better to consult an orthopedic surgeon.